Hi, this is Dr. Martin with Ridgeview Medical, and today I wanted to go over some of the common knee pathologies, some that we see coming into our office, and I'm going to use our virtual consultation to go over those. Okay, so here we go. So the first one is a meniscus tear. The meniscus is the padding in between the knees. Whenever there's a meniscus tear, there's usually a tendency for the leg to get stuck or locked up, difficulty bending and straightening the leg. There can sometimes be a popping sensation during the time of the injury. You may be able to finish what you're doing, but then the swelling will tend to set in. It's a little slower, but there's definitely some pain. Okay. The next one is an ACL tear. So the ACL is a ligament that's on the inside of the knee. So this is generally when people have pain under the kneecap, but there's definitely a loud pop in the knee. There's severe pain and the inability to continue at whatever activity you're doing. There's rapid swelling, loss of range of motion, and it's characterized also by people feeling instability when they're standing. Okay, so the next one is the MCL, and the MCL is very similar, but it's in a different location. The MCL is on the inside of the knee, and so usually there's some kind of blow to the lateral side of the knee that tears this ligament. With the ACL and MCL, there can always be either a partial tear or a full tear. And that can be the difference between getting some regenerative medicine for it or having to have surgery. So the next one here is degeneration. So this is when you think of arthritis, knee degeneration, this is where there's like a wearing away. Okay, usually we find that there's been some kind of previous injury, somebody's been hard on their knees that starts this process, but there's more pain with activity, and then it usually gets better when you rest. There's swelling, can be a feeling of warmth inside the joint. There's stiffness more in the morning or after sitting for long periods of time. Stairs can become a problem, and there can be like creaking or crackling with movement. So these are some of the conditions we see and treat in our office. With knee pain, it's definitely better to get checked out sooner rather than later. Once something becomes a full tear, like ACL or MCL tear, really that puts you in the category of surgery. So our nurse practitioner is trained to be able to evaluate your knee and find out what needs to be done. So give us a call at Ridgeview Medical. Our number is 972-596-6000.